Strabismus is a misalignment of the eyes. So whether it be the eyes may be crossed, they may turn out, up or down, that is what strabismus is. And the concern about strabismus in children is that it could be a cause of amblyopia or decreased vision in one of the eyes. When the eyes are crossed, it is called esotropia, and when the eyes are crossed, oftentimes a pair of glasses will straighten out the eyes. But if the eyes have been crossed for a certain length of time, it is a possibility that one eye may have less vision than the other eye, and even with the glasses. And if that's the case, then you have to patch the good eye to make the bad eye better. Sometimes glasses don't help, and a child may need surgery. The thing about esotropia, or the eyes crossing, that is more often than not a cause of amblyopia, whereas exotropia, when the eyes are drifting out, it oftentimes does not affect the vision. But if it starts to happen, oftentimes it happens intermittently, so it's well controlled. But if a turn out becomes under less and less control, then the child may need to have surgery to fix the turn out. When the eye drifts up, that's oftentimes not a cause of amblyopia, but it's something to be watched as well, because it could cause changes in head position. Because oftentimes when the head is turned a certain way, it fixes the turn. I may see a child whose head is turned to the right, and if it keeps turning further and further to the right, it could cause neck strain. So that child may need surgery as well. There are many types of strabismus. There's the type where the eyes could be crossed. They could turn out. They could go up, or they could go down. When the eye is crossed, the treatment is oftentimes glasses will treat that problem. Sometimes these children also need surgery. When an eye is turned out, these children sometimes could be observed over time. Other times they may need surgery as well. When an eye is drifting up, the same thing. Sometimes that could be fixed with glasses, sometimes with surgery. But it is important to evaluate your child if they have a misalignment, because it could cause decreased vision and it needs to be addressed at an early age.